Hi, everybody, and welcome to today's event, Inclusive Innovation Insights for Black and Latino Startups. We're delighted to host this event to discuss how digital health and technology impacts health equity in the Chicago innovation ecosystem and beyond. My name is Olivia Phillips, and I'm a partnerships manager at Matter. Matter is a healthcare technology incubator and innovation hub with a mission to accelerate the pace of change of healthcare, and we do three things in service of this mission. The first, we incubate startups. Since 2015, we have worked with more than 800 companies that range from very early to growth stage startups, and we have a suite of services to help them at every stage of development. Second, we work with large organizations such as health systems, life sciences companies, and payers to strengthen their innovation capacity. We help them find value in emerging technology solutions, empower internal innovators to unlock the value of their ideas, and create a more human-centered healthcare experience through system-level collaborations. And third, we are a nexus for people who are passionate about healthcare innovation. We bring people together to be inspired, to learn, and to connect with each other. We produce a lot of programs, including large-scale events for the broader community, like today, and small forums exclusively for our members. At Matter, our ultimate goal is to contribute to making diversity a core and abiding strength of the healthcare and entrepreneurial sectors. And one way we do this is by uplifting underrepresented voices in the ecosystem. Today is one such example where we will hear insights from diverse founders on how to create a more equitable healthcare landscape. Before we jump into the panel discussion, I'd like to introduce our moderator, Philip Burton, founder of InHuevation, an organization focused on reducing barriers of access in the fields of healthcare, innovation, technology, and venture capital for BIPOC entrepreneurs and leaders. Philip will pass it over to TR Muse, who will kick us off with the presentation about the National Association of Health Services Executives. If you have questions throughout the program, please put them in the Q&A function, and Philip will make sure to weave them into the conversation as appropriate. There will also be time at the very end of our program as well for Q&A from the audience with our speakers. With that, I'll pass it over to Philip to dive into the discussion.
Thank you so much. So thank you, Olivia. I greatly appreciate you passing over and starting this meeting. Philip Burton, very excited for this evening, excited for this discussion. It is a passion of mine when we think around diverse founders. And so would like to, when I was thinking about creating this event, there are a couple of different organizations just made perfect sense. Matter, one of the foremost healthcare incubators in the nation, as well as a couple of different associations, National Association of Health Service Executives, NAHSE, as well as NALHE, National Association of Latino Healthcare Executives. With that, I'll introduce TR Muse, who is the chapter president for Chicago for NAHSE.
All right, thank you, Phil. So I will go ahead and share my screen. All right, so Phil and Matter, on behalf of the National Association of Health Service Executives, Chicago Midwest chapter, I would like to thank you all for having me. I am the chapter president for NAHSE Chicago, TR Muse, and my background is actually in executive recruitment, but I was told that I had 5 minutes, so I will keep that in mind as I get right into sharing an overview of the National Association of Health Service Executives. So NAHSE, our mission statement is to really empower the next generation of healthcare leaders, and we do that in a variety of different ways. One of the things that we do have beyond the city of Chicago, we have 30 plus chapters across the country. We also have over 2,200 members across the country, and we focus on mid-level as well as students, as well as executive, senior executive level leaders across the country. We also have, in Chicago specifically, a number of events that we host each year. One of the events that we host is a spring fling. So if many of you were present for the American College of Healthcare Executives Conference most recently, we welcomed over 300 plus executives, students, and leaders to that event this year. So I'm also pleased to share a little bit about what NAHSE Chicago has coming up. We locally have 100 plus members in the Chicagoland area. We also partner with a number of organizations, including the Black Health Connect group, which we have an event coming up with them on May 31 that we would like to extend an invitation to you all to. We also have a partnership with the National Illinois Kidney Foundation, where we participate in raising money, and we also have a team. We also have a general body meeting coming up, which we would welcome you all to June 11th, and more information will be coming soon via Eventbrite. One particular event that I would also like to highlight with respect to NAHSE Chicago, and as you can see, we're wanting to get you all engaged, so I'm focused on some of our upcoming events, is the Living Legends event, which will be July 25th at ChiCat, the Chicago Center for Arts and Technology, where we're focused on some of our past presidents and our most recent leaders. So the session will be specific to storytelling, leaders that have both personal and professional triumphs that they would like to share with members as well as the general public. So we absolutely would love to see you there. This is an in-person event, and we'll also have tickets via Eventbrite in the next few weeks. One of the other things that I would like to mention that's specific to NAHSE National is we have an annual conference each year. This year, the conference will be held in Fort Lauderdale, Florida. During the conference, we also have an annual student case competition. Throughout the course of this event, we welcome executive leaders and students across the country. This year, we'll have representation from NAHSE Chicago present, and we also welcome you all to find out more information about this conference on our national website. If you are interested in engaging with our local chapter and keeping up with our upcoming events and also learning more about our committees and potential membership, I would encourage you all to use the QR code that's noted in the PowerPoint. We also particularly put our upcoming events and information pertaining to our chapter on LinkedIn regularly, so you can also follow us there. We also have an Instagram account at NAHSE Chicago on Instagram. So my information I'll drop in the chat, or will be available after today's meeting if you would like to learn more about NAHSE Chicago and or become a member. So thank you all for having us today.
Thank you so much, Tiara. Great introduction to NAHSE. I've been a longtime member, serving as Chicago chapter president, serving on the national board. It is a great organization specifically for African-American healthcare leaders. Another organization I'm happy to introduce this panel or this group to is NAHLE, NALHE, which is National Association of Latino Healthcare Executives. So Christina, can you please come on board and tell us a little about the organization?
Sure. Good evening, everyone. Thank you, Phil and Matter, for having us this evening. Like Phil mentioned, I am Christina Martinez, the National Association of Latino Healthcare Executives, also known as NALHE. I'm the immediate past president for the Chicagoland chapter. I'm very excited to be here and partner with Phil and Matter on this. I am a registered nurse by background, and I am currently a director of compliance and privacy officer for local F2HCs. NALHE is about, our mission is to promote health equity for Latino communities by increasing our representation within the healthcare systems and by supporting policy and legislation and regulation that seeks to improve health and healthcare outcomes for our Latino communities. Our vision is to be the professional association of choice that transforms Latino and Latinas' experience in the national healthcare leadership space. We want to make sure that we're getting our voice heard in all healthcare spaces. So whether it's hospitals, community, public health, or even startup innovation groups like the ones we're talking about today. I wanted to show you guys briefly who our past and current president are. These are our Chicagoland board presidents. We just announced Richard Grego. He is our current president for Chicagoland area. He started in February, and his term is for 2 years. I transferred my presidency over to him just back in February. Prior to me, we had Nancy Alonso, who serves in the human resources industry within healthcare. We are looking for chapter membership and increasing our board committee. So if you are interested, please let us know. I'll provide that contact information at the end. Our chapter started in 2019. We launched it in 2019. So we've been going on for about 5 years now. We do have chapters located throughout the United States, SoCal, Dallas, Fort Worth, Texas, the tri-state area on the East Coast, Florida, and we're continuing to expand across the country. We also have our neighbors, Wisconsin, Milwaukee, Wisconsin, and Indiana. I wanted to share with everybody our upcoming events. So just put a few on here. We do have one coming up in May with Chicago Healthcare Health Executive Forum Chef, a diversity panel. It is an in-person event. It'll be located in Oak Brook at Pinstripes. Registration is up. You can go to the chef homepage and register for that event. We do have a summer networking event, which is underway. The planning is underway now. The dates will be announced in the next couple months, so look out for that. I also wanted to give a little plug for our annual Leadership Summit, which is in September this year. It's going to be in Dallas, Texas, September 11th through the 13th, and registration is live for that. We welcome everyone to join us. It's just 3 days. We have a volunteer opportunity, we have education sessions, and we do have a gala on the second night. So please register. We invite you all to register. Staying in time here, just wanted to give some information on how to contact us. So you can join our chapter or a local chapter of yours in any of the states that we are present by going to NALHE.org/join. We are offering a coupon for the first year membership free with the VIP code listed there. If you're interested in the Chicagoland chapter, feel free to email us. Our email is right there. We also have a LinkedIn page. It's under @NALHE, NALHE space Chicagoland. If you're interested in becoming a board member or seeing additional opportunities for our chapter, please email us or reach out to us on LinkedIn. And thank you.
Great. Well, thank you, Christina. I appreciate you giving the information for NALHE, a great organization. Christina and Nancy have done a great job of launching this local chapter in the midst of COVID. The national organization is growing. Actually, one of my colleagues at HMA, Jose Rubles, has just been announced to the national board. So there is some Chicago presence on the national board. And so, again, two organizations that I think just are very fitting when we think around information around Black and Latino healthcare startups, two associations that are geared toward healthcare executives. I think everyone on this call should know about NAHSE and NALHE. Well, now at this point, it's an opportunity for me to introduce someone who I am just extremely honored and privileged to know as a friend, but also just a resource of great information. And so Gyasi Chisley will be our kind of our keynote, kind of kick off the setting for tonight's discussion. But let me just take a few minutes to talk about him. I love bragging about him because I know him personally, but professionally, Gyasi has more than 25 experience in healthcare industry, has led many health systems, health plans, investment venture. He's been a functioning senior executive in various sectors within healthcare, whether it be government, private, Fortune 500 companies. As a president and CEO, Gyasi has led health systems from Atlanta, now Wellstar, New York, formerly Catholic Medical Center, Cincinnati, Ohio, which was UC Health and Mercy Health. In Memphis, Tennessee, he was part of Methodist Healthcare and the National Cancer Network in multiple metropolitan locations, Cancer Treatment Centers of America, now City of Hope. In every role, Chisley has been able to establish considerable amount of growth, forged significant partnerships, and definitely instituted strong financial stability with just a unique clinical acumen. And so subsequently to that, Gyasi has held senior vice president role as chief strategy with United Healthcare, where he's gone to the dark side of healthcare, as we sometimes joke about, but he's also a well-renowned author. It's a great read. I recommend this. I bought this for some of my mentees, but Healthy Disruption, and he'll talk a little bit about this, but a great read. Anyone is looking for a read for themselves or to pass on to mentees is a great opportunity to look at healthcare from the perspective of an African-American leader. In addition to that, Gyasi has received numerous accolades for his achievements, whether it's Becker's Top 25 Healthcare Executives, Modern Healthcare Up-and-Comers, Tenet Circle of Excellence Award, the NAHSE Young Healthcare Executive of the Year. In addition to that, he was ACHE Young Executive of the Year, Xavier University Preceptor of the Year, Cincinnati Business Courier 40 Under 40, Leadership Academy Alumni Award, And then near and dear to his heart, University of Michigan Award for Service. So Gyasi holds a master's from University of Michigan, go Blue. He also has a dual Bachelor of Science degree in Psychology and Biology from Morehouse College. He is board certified in healthcare and project management. He is an avid sports fan, a self-proclaimed movie buff, enjoys music, running marathons. He is a lifestyle aficionado. He has been a friend of me, someone who's come and helped me in many different situations. So with that, I want to turn it over. Gyasi, please say hello and tell us a little information that you'd like to share with us.
Thank you so much for that warm introduction, Phil. Please, I sometimes get a little shy when I hear my own bio being read, but I really appreciate the warm welcome that you've extended, as well as Matter. I want to talk to you a little bit today about two of my favorite topics. One is healthcare and two is money. So I'm going to try to condense this into a 10-minute speech, but it probably won't do it justice. But hopefully we'll get to some Q&A here quickly and then off to the panel discussion. I'm super excited about some of the things that I'm going to share that we're researching actually in my current role as the head of corporate healthcare for PNC Bank. PNC is the 5th largest bank in the country. It is on Wall Street and it trades on Wall Street. We have about 620 billion assets under management, as well as competing with all the likes of the big bank. And what we do within healthcare in and throughout the bank is we work across the bank. So all the way down to business banking and small businesses, in and throughout retail. The corporate bank is actually where I sit, but then also deal a lot with investment banks and a lot of deal structure and deal flow as well. So a lot of M&A activity has already occurred in the first quarter of 2024. So let's get into it. Healthcare is big business, obviously within PNC, and it's big business as it relates to the entire healthcare ecosystem in this country. So I've stolen a couple of quotes from disruptors that I think you should actually know, because these are individuals and companies that are actually conducting a lot of the transactions that happen in and throughout healthcare mainly for the past 6 or 7 years, certainly before the pandemic. So Andy Jassy is the CEO of Amazon. He's just saying healthcare is kind of nutty, and the way in which we deliver care is kind of stupid in this country. I tend to agree at times. It's certainly ripe for disruption. Judy Faulkner is the founder of Epic, based in Madison, Wisconsin, not too far from Chicago. And she just says that AI is actually going to be a further disruptor to the healthcare landscape. And then Jamie Dimon, JP Morgan's CEO, is just indicating from a 2024 standpoint and beyond that we're actually going this log jam that we're seeing with a lot of dry powder, and I explain what that means here in a second, within healthcare. There's going to be a lot more transactions. At least that's what he's predicting in the future of healthcare. So just the healthcare industry overview. So I know this is a very, very busy slide, but I wanted to sort of frame for all of you and the entire audience how big healthcare is. It is the largest sector within our nation's economy. It equates for almost 18% of the GDP, the gross domestic product. We spend about $4.6 trillion each year. That's up year over year, almost 5%. That's the highest gross per capita sector within our nation's economy, higher than education, higher than defense, higher than any other sector. So we spend a lot of money, but we get poorer outcomes. We're spending about $13,000 per individual in this country on healthcare alone. And obviously that number is going to continue to rise as baby boomers get older and people start to require more care. And as consumerism starts to take fold and take shape too. So here's some of the breakdown of spending sources. Just two things to note here. Obviously, the physician and clinical services is the largest chunk, more than 40%. And then you'll see hospital care is sort of that second chunk. Just 5-6 years ago, those chunks were much larger. It actually equated for nearly half and half of the pie. So you see how healthcare is becoming much more corporatized, and we're actually seeing a shift with a lot of private equity, a lot of disruptors in healthcare coming into the space. There's also a lot of different funding sources. So he who controls the wallet pretty much controls healthcare. That still is, quote unquote, the dark side of healthcare, which is the payers or are the payers. So there's a lot of private healthcare insurance, but the public healthcare insurance as well. We tend to sort of start our processes around value-based care and some other things as it relates to how CMS and policymakers dictate how they think healthcare should go. So I've just sort of framed out for you on the bottom, sort of the 7 Ps, as I like to frame them. There's 6 down there. We'll get into the 7 here on the next slide. So patients, providers, payers, policymakers, big pharma, and then private equity. And then on this slide, I'm just highlighting private equity as a major force within the healthcare space. Obviously, the providers are still the centricity of and the epicenter of healthcare. Payers, we already talked about, given the wallet and the reimbursement and how healthcare is reimbursed in this country is certainly a force. Everything that's going on with GLP-1s, Ozempic, and some other things with Novo Nordisk, now having literally $1 trillion market cap. Those things are all significant. But still, private equity is a force that I think is going to continue to be one of the driving disruptors within the healthcare space. The emergence of sort of 4 distinctions and diversifications within healthcare. I call them the 4 Ds. Device, digital, disease type is service line. So I'm a diabetic, so I actually have type 2 diabetes. Diabetes is one of the leading causes of death in the African-American community. One of the things that drives it is actually poor access to care. But the other thing is actually adherence to care as well. So if you're a diabetic, or if you have COPD or any other chronic disease, even cancer, I consider as a chronic disease, that's what's going to drive up spend. And that's what is also driving disruptors into the space as well. And then big data. I've highlighted that here just because I think data will continue to be commercialized in this country for quite some time. And then here's sort of the risk or the management focus areas, and risk being number 1. How do you manage and mitigate risk, either on the payer side, the provider side, or any other side or sector within healthcare? Remediation is just a fancy word for process improvement. Reentry is just a fancy word for integration. So as M&A continues to go and continues to flow, we're going to have to understand, how do we integrate the acquisitions that we're actually acquiring? And then obviously big into the space, I should probably highlight this one as well, is retail. The CVSs, the Walgreens, the Walmarts, even Amazons of the world are all entering into the healthcare arena. And then I talk about this and reference this in the book, sort of the 7 Cs. This is how I think you differentiate yourself and your company as it relates to healthcare: culture, consumerism, understanding consumerism and behaviors of consumerism. There's a lot of consolidation, obviously, in this space. We talked about the commercialization of a lot of things that exist already in the healthcare ecosystem. But my big thing is partnerships. So how do you build and establish partnerships, coalition building, and then concept to execution? We got a lot of ideas in healthcare, but we're really poor at actually executing or getting ideas off the ground. And then control. Who has the control, whether it's perceived or whether it's real? That sometimes gets mired in a lot of issues, and it tends to slow us down and make our industry less nimble. So here's just some transaction flows. It wouldn't be a presentation for me, at least, without some data. This is a very busy slide. Again, I apologize, but I can break it down pretty much in the 3 steps that's in. We saw a really turbulent year, or we had a really turbulent year last year, particularly in the banking world and in healthcare, still coming off the heels in healthcare, of COVID. So healthcare obviously is struggling. A lot of the not-for-profit health systems still working to get volumes back and try to find creative ways to deliver care. The banks obviously suffered with the news of SVB, Silicon Valley Bank closing, and some other banks closing. But that sort of led to different kinds of deal flow, which I'll get into a little bit more data here in a second. And it's happened around the middle market. So that's what this sort of first portion of the slide is trying to indicate, that a lot of deals happen in the middle market space. From a non-for-profit and non-for-profit perspective, or from a non-for-profit to for-profit perspective, those were the 2 largest chunks. So that's how companies are starting to exit either selling out to a not-for-profit entity, selling out to private equity or private capital, or selling out to an entity or large entity like a retailer. There's a lot of shifts in the dynamics and the density, if you will, of the market. So a lot of the things that are coming through are expecting, and that's why there's so much consolidation in the space, is there's a lot of people that are trying to just buy their competition if in fact they can't partner. And then there's going to be continued regulatory scrutiny, not only in the healthcare deals with the FTC, the DOJ, at the SEC, but also in banking as well. There's a lot of heightened regulatory risk on how mergers and acquisitions are actually occurring. This is just a slide that I like. It's simpler, but it's just gives you, from the histograms, from the bar charts, gives you an idea of what the deal count was and what the estimated deal count was back in 2023 and previous years, particularly for healthcare services. So this is the source is PitchBook, if you guys are familiar with that. So we actually thought there was going to be close to 800 deals or 800 transactions just in healthcare services alone in 2023. It was significantly below and less than that, and I'll tell you why here in a second. And then in the tech world, it seems as though PE is actually getting out of tech, private equity is getting out of tech more so, and VC is actually entering in. But you always see this sort of very harmonious exchange or marriage, if you will, of healthcare services and healthcare tech. And they're getting married for a reason, because they both need each other. One can't operate without the other to make a holistic platform or service offering for a patient. Here's some more data on just M&A activity. I know I'm coming up on time here. So it breaks down from healthcare facilities and services to managed care and insurance to healthcare technology. This is broken down by quarter. So like I said, we've already seen a pretty strong quarter in Q1 of 2024. That healthcare facilities and service data, we're already sort of trending at $1.9 billion, almost $2 billion with 66 deals. And the average deal size being about $25 million just in healthcare facilities and services alone. And then healthcare tech's a different story. It sort of ebbs and flows, and it actually is pretty aligned with the stock market. If you look at deal-to-deal trends and day-to-day and quarter-over-quarter trends. Just some highlights here below. I won't read too much into this, but there's a lot of cross-geography and cross-pollination within deals, a lot of focus on digital, as going back to the 4 Ds, as well as a lot of focus on workforce management, because that's where labor is actually where healthcare services is hurting the most. They have the most pressure point. This is what I was talking about, dry powder. So dry powder is a euphemism within private equity and within the banking world that just means how much cash reserves do you have? And those cash reserves are actually earmarked for things that you actually want to go out and acquire. So there's roughly about $1 trillion out there in total dry powder. But if you look at down at the orange line there's roughly there's over $100 billion just for healthcare services alone. So what does that mean? It just means that, going to this slide, there's a lot of money out there, but few deals and transactions are happening because people are keeping their wallets pretty close to the chest, given the fact that inflation is still high, interest rates are still high, et cetera. So if you see in the 2023 graph, there's been roughly about only 16 deals done, or the 16 funds raised, I'm sorry, but the capital in billions there is just astronomical. So there's a lot of money out there just waiting to be sort of utilized in services. And that's why I think 2024 is going to be a big year for healthcare from a transaction standpoint. These are just more slides that just indicate we've had a significant downturn in some of the private equity services arena, roughly about over 75% decrease from 2021 from a public listing and acquisition and buyout perspective. I do think that that's going to increase significantly in 2024. So you see in 2020, that one gray bar at the top, it's literally one. That was an outfit called One Medical, if you're familiar with it. They're spattered in 28 markets. and have sort of focused on concierge medicine. They were bought by Amazon right after they went public in IPO in 2020 and 2021, that they were bought by Amazon for about $4 billion, $3.9 billion, and now they're part of the Amazon family. So it's just things like that that are going to continue to occur within the healthcare arena. And then here's more deals about home health. Here's further breakdown about primary care, occupational correctional PE deals, and urgent care deals. Here's data about clinical trials. I do think pharma is going to have an uptick as well in 2024. Infusion in the home is actually going to uptick because people obviously convalesce better when they're at home, actually in their own home, whether it be cancer or any other chronic disease, and in specialty pharma deals. And here's just a quick outlook of what we think is going to happen based on periodicals, based on things that we're reading, based on modern healthcare, based on PitchBook, the Wall Street Journal, et cetera. Large platform trades are going to continue as interest rates fall because they will have to fall at some point because they're extremely high. There's a lot of things that are going on in the special category space that are going to impact deal flow. So that they probably won't return to where we saw them pre-pandemic, but they are going to increase. There's going to be more creativity in LBOs, leverage buyouts, and IPOs, initial public offerings, funds and direct investors. There's going to be a lot of creativity. So fasten your seatbelts. It's going to be an interesting ride, I think, here in 2024 and beyond. There's going to be opportunities for consumerization, both in med spa, anything that's out of pocket, anything that's sticky, that the more affluent individuals can afford. That's going to pop up. Even healthcare adjacent services are going to pop up. And then there's going to be emphasis on how do providers actually help control costs, not necessarily from a Medicare Advantage or a primary care perspective, but how do they control costs overall? There's going to be a continued pivot to the pharma industry, particularly as GLP-1s and Ozempic gets even more popular. They're talking about that might be oral here in the future, in the near term. That's going to be a game changer as well. And then there's obviously going to be heightened commercialization and partnerships with those entities that are sort of serving and having data. Data is going to be big here in the future. So, Phil, that's what I've sort of wanted to impart on the audience today, just to kind of understand where are we going, what does it look like, how are things happening, what do transactions look like, and hopefully that sets the stage for the panel discussion coming up here soon.
Absolutely. Thank you, Gyasi. I really appreciate it. Oftentimes when we think about healthcare, we're very focused on solving the problems or thinking about quality of care, but we oftentimes don't think about it from the standpoint of the business of healthcare. And that's why I wanted you to set the stage and think about the business of healthcare. You share so much information, but, a couple of things, right? We think about how big healthcare is. You mentioned it, 18% of the GDP, $4.6 trillion and growing, right? I mean, those numbers are just staggering. You gave a quote, one who holds the wallet owns healthcare, right? I mean, I appreciate that. I don't think I'm gonna try to go into the 7 Ps, the 4 Ds, the 4 Rs, but definitely things how we can think about from a category perspective, right? And so hopefully this conversation, right, is going to be aspirational for those people who are in healthcare, who are thinking about, potentially doing a startup. How do they think about it from a standpoint of what are the trends, right? Where's the money going, right? You gave a slide that showed the shift in how things were nonprofit. Now it's going to more for-profit and private equity, right? We need to think about that business scenario. And so we do have a couple of questions that I'm going to get into, but I definitely want to just say I appreciate you coming and giving perspective around, the business of healthcare. There are a couple of questions. Let me go into that. The Queen asked a question. It says, I like how you said just buying out the competition. Is there a better way that you can say that in regards to the closure of several CVS, Walgreens retail chains across the nation, including some of the major hubs like in Boston?
Yeah, it's a great question. There's several reasons why I think all the sort of major retailers, including Walmart, are closing. And it seems as though, obviously, Amazon, who's now actually trying to get into the bricks and mortar space, ironically, had the best model because it's all going to digitization. And I think we saw a heightened sort of focus of how digital can impact and how easy and convenient things were to sort of store and buy, even from glucose monitors to blood pressure cuffs to anything and everything that you made it to Vaseline, anything that you need from a healthcare perspective, you could pretty much get on Amazon. And I think sort of Walmart, Walgreens, CVS sort of followed suit. One of the things that is sort of mitigating the bricks and mortars, even the pharmacy perspective. So even PBMs, pharmacy benefit managers, are not as pervasive as they used to be, because just like everything else, they're consolidating around themselves. So there's only like 4 or 5 big PBMs here now in the country. So all of that lends itself to less people coming into the store, less people sort of buying candy bars and other things as they go into the store, and then obviously leading to some closures of those retail outfits. So we're seeing it in and throughout the country, and I know you see it in Chicago as well.
Thank you. If you have any questions, please ask. I know we're going to go into the panel, but I definitely appreciate it. Appreciate your commentary. You know, you touched on a couple of things when we think around the categories of 4Ds: device, digital, disease, and data, right? I don't think we think enough around how data is key, right? And so,
Yep.
you know, one of the things, again, I've worked and coached in a couple of minutes, I'm going to go into InHuevation, how I've worked with a couple of different healthcare startups. And oftentimes I've seen founders come in from the good intention of wanting to help, wanting to solve, right?
Right.
But not oftentimes adding those elements that are going to be critical for scale, right? Digital data, right? Understanding the different sectors. Anything you can add on just how key data is going to be, in where startups kind of put their emphasis on their platform or their structure.
Yeah, I think it's going to be key. And any time that a startup can leverage the data that they either already have or are aiming to get, that's a whole nother sort of revenue generation service model that you can incorporate, and or you can sell those data very appropriately, of course, to different healthcare entities, and they'll actually buy that. So the other thing that I think we don't do in healthcare well enough is we don't do a lot of predictive analytics. So that's where data can come in, and market intel, and that's where data can come in as well. The last thing that I'll say, Phil, I'd be remiss if I didn't say this, just because it was, I think, the largest event within our industry that happened February 21st of this year, and that was the Change Healthcare event, the cyber attack breach. To date, that's been the largest breach that we've had in healthcare, but I predict that that's going to actually continue. And there's going to be a lot of things, because again, healthcare is very, very personal. It's personal to me, it's personal to you, it's personal to our families, and we got to make sure that it's protected, because it's more than just. I work at a bank, so even more so us getting attacked and money getting attacked. Imagine having your PHI, your personal health information, being attacked as well. That's no fun. So data is something that's going to be heightened. There's going to be a heightened focus. And I definitely think that we're going to have to make sure that we start to put parameters around it. And obviously, just like everything else, the government's going to come in and try to regulate how in which we're utilizing those data and actually selling those data as well. So all things to think about, particularly if you're a startup.
And the ransom people got paid too, right? So it just
did get paid. I hate some ransom at that. Yes.
You said something about predictive analytics that really is a segue into. There's a question from Andre that said, what are your thoughts on the 8th P, prevention?
Yeah, it's a great one. I think that there's a there. I don't think we've leveraged how we add prevention sort of. We talk about acute because most of us have sort of grown up in hospitals. We talk about post-acute, the SNFs, the LTACs of the world, but we don't talk about what doesn't exist yet, and that's pre-acute, and that's preventative. And that's what I think Andre is speaking to. I do think it's a business model that needs to be explored. However, I don't think that it's been very lucrative, other than your health clubs, your health plans, all that kind of stuff. But even things within Medicare Advantage, like silver sneakers and offering benefits and incentives to seniors through a Medicare Advantage plan, hasn't gone over well, because you don't think about healthcare when you're healthy. You think about it when you're sick, unfortunately. So we got to change that model, got to change that mindset. And that was actually the first sort of C in there, and that's the culture. The mindset, in my opinion, is perfectly aligned with the culture and how we think about healthcare in this country, or don't.
Well, thanks so much. I'm not sure if you're going to stick around. Another plug. Great book, Healthy Disruption. We're going to go into the panel right now, but thank you, Gyasi. I really appreciate it. I'm actually going to share my screen, and just kind of as we start to introduce our panelists for tonight, how did this conversation came about? So my name is Phil Burton, 20 plus years in healthcare, Started off in pharma, went into medical device, was a hospital administrator for Advocate here locally, have been in consulting, currently with HMA, but have a passion, and I've started a social impact. It's called InHuevation. And so if you see here at my screen, InHuevation is a play on innovation, but the focus on Hue, helping out diverse founders. What we see is that African Americans and Latinos make up a third of the population, but yet we receive less than a third of the venture capital. And so there are some true disparities when it comes to healthcare, diverse healthcare startups. And so InHuevation was really created as a social impact. How do we solve that gap? You know, how do we create programming that are geared toward diverse founders, but also how do we bring or do the wraparound services and work in partnership and collaboration with organizations like Matter in 1871 that bring that great skill set when it thinks of innovation technology for diverse founders. And so when we think around disruptors, when I think around founders, I'm thinking about these are some local startup companies. You know, what community do they really have supporting them? You've got Smart Charts, Clinifi Health, Star Cunningham with 40 Health, where I'm thinking before someone else mentioned Cancer IQ, FACHE. And so there's some great founders here in the local area, but do they really have the support that they need? And so that's one of the reasons why I started InHuevation. And so part of that is really looking at how do we create these inclusive innovation forums. Like tonight, we have this inclusive innovation insights for Black and Latino healthcare startups. I've done roundtable discussions here in Chicago, Nashville, and Atlanta. We're going to do some things in Charlotte, Dallas, and Miami coming up. But one of the things is starting a summit that I'm going to be doing this summer, just bringing a community of diverse founders together. And so with that, I'm going to now introduce you to some diverse founders that I think can share some great insight. And so with that, I'll hope to bring on Luis and James. Can you please come on board?
Okay, Philip, thank you so much for having us.
Hey guys, I'm excited to have a conversation. I'm excited to just hear your story. And so with that, just because of where my screen is, James comes up, then Luis. If you don't mind, take a few moments, just introduce yourselves, kind of share your background, how you touch healthcare, what led you to become a founder, and then briefly, if you can, to talk about your company that you founded, what problem are you solving as a startup? So James, if you don't mind, I'll start with you, Dr. Lott.
Hey, thanks so much. Really appreciate this opportunity, Phil, to kind of share the story to some other founders. Folks, I'm James Lott. I'm a Louisiana native that has made Chicago home. All of my education, my higher level education has been on the South Side, Chicago State, U Chicago. I love the South Side, and it's a great place to start a company because you have so much support. My company, Scripted, we enable pharmacists to provide direct patient care. Just imagine it's actually happening today where if you can't get access to a physician because we have a really massive physician shortage, you can go to your local pharmacy, you get tested, treated, they're prescribing you antibiotics, they accept your medication. And we've been working on this for several years on a play of the provider shortage, which is getting pretty bad late. And laws are changing and enabling pharmacists to step up. I kind of came across this opportunity when I was a pharmacist. I actually worked in the most diverse zip code in the United States. Surprisingly enough, to me at least, it was in Washington State. But it was really interesting because I really loved my job as a pharmacist. I took it really seriously. And with the diverse population, some of my patients would be from all over the world. They would come to the pharmacy first because many were uninsured, they couldn't afford to go to the physician, et cetera. And of course, if they needed to go to the physician and I saw something that I didn't like, I would refer them. But in many instances, a lot of the conditions that they had were minor and could be treated with a basic over-the-counter medication or a really simple prescription. So that's kind of where the concept came from. Several years later, we launched Scripted, and we have a lot of pharmacies using the software today, and we'll be announcing a big partnership that'll introduce Scripted to thousands of pharmacies nationwide. So really excited about that. I think last thing is how I've interacted with healthcare. I think just being a Black founder, I think that a lot of times I'm Nigerian American, and a lot of times what I've noticed is a lot of Black people, they send their best and brightest to the medical field. You know, other industries, they go into finance, they go into computer science, but we send a lot of our best and brightest to healthcare. So I've always, you know, I've always thought that was A, interesting, but B, you know, I think that we have enough great minds that are Black and brown in healthcare. And I wanted to do something a little bit different and provide, I guess, greater scope and impact from my experiences. So.
Great, thank you. And well, I think it's you know, reasonable for to mention that you are a member of Matter Incubator, correct?
Yep, long-time member. Dating myself now, though.
Luis, please take a moment to please introduce yourself. Again, same question. Can give us a little bit of your background. Talk to me a little bit about, you know, how your background has touched in healthcare, which might have led you to become a founder. And then, if you can, you know, what is Sanarai solving for? What are you solving for as a founder?
Of course. So, hey everyone, I'm Luis Suarez, founder and CEO at Sanarai. I am originally from Mexico City, came to the US to do my MBA. I went to Duke University in North Carolina. And when I graduated, I worked for 3 years for a management consulting firm, mainly doing digital transformation and M&A work there, strategy operations management consulting firm, and some of that work was within healthcare for big pharmacy chains and places like that. And that's how I started getting involved in the field. And eventually in 2020, I was looking for mental health services for myself. And I was having a hard time finding someone that I could speak Spanish with and that I could fit in my schedule. So that's when I realized that there is a big gap to cover the Latino community's needs in terms of mental health, and specifically for Spanish speakers. So only 5% of mental health providers can speak Spanish or administer their services in Spanish versus 14% of the population that speaks Spanish at home. And then treatment rates for this community are way below the average. And then in the context of a mental health crisis with booming demand for services and a shortage of mental health professionals, a problem is exacerbated for this community. And yeah, back in 2020, I decided to start Sanarai with a mission to improve the Latino community's needs in terms of mental health.
Great, thank you. We do have a couple of questions. If you don't mind, Guy and LaQueen, I'm going to hold off just for a little bit. We're going to ask the panelists a couple more questions, I think, and then we'll come to your questions at the end. So I won't forget your questions. But thank you both. And so you tell me in order that you want to grab this. But you know, as a diverse founder, we both have mentioned that diverse founders. You know, can you share about your experiences navigating, you know, as a founder, healthcare systems? Particularly, have you encountered any kind of unique challenges or barriers to you building the solution that you have? Luis, I'll start. We'll go with you and come back over to James.
Yeah, I think healthcare is a heavily regulated field, like so are other fields like finance, for example. But particularly, I think that the complexity and a lot of like what Gyasi was mentioning is, you know, that there's this all this work that has to be done around privacy, and as startups, we have to make sure that we comply with HIPAA and things like that, and we're very serious about our cybersecurity. And yeah, so I think the regulatory, you know, like just the bar is very high, and with the regulatory challenges, and that's something that we have to be mindful of. And honestly, you know, I think I kind of like started from a naive point of view, and you know, thinking like, okay, I can build this and provide like better services and better product, you know, like getting better products and services, right? Which is like the very, you know, the very kind of like mission for startups, and you know, and then you gotta like think about like these whole other things that like regulation and things like that you have to take into account. And I think what is really helpful is once you start, on that journey, getting folks that are experts. Like, for example, we have investors like California Healthcare Foundation, One Mind, which is a very prominent mental health organization in the Bay Area, organizations like Matter. And once you start getting involved with those organizations, you start like learning a lot and overcoming some of those barriers.
Nice. James?
Yeah, for me, I guess, as a diverse founder, I think that for me personally, I think you're exposed, what you're exposed to is typically, sometimes it's your ceiling, right? So I can't say that I grew up saying I would want to be a founder of a startup. It definitely, long story there, but it just kind of happened. I didn't know anyone who, owned a technology company or a company in healthcare that was scaling. It's really interesting to me now that I'm in the space, when I meet other founders, how many of them had started off working for a startup at first. Maybe they had an exit. They saw another founder struggle, but they helped them out, from being one of the first 5 or 10 employees to exit. And then they got the confidence and the compassion to go and do it themselves from what they learned. That's a story that I'm not familiar with. I just kind of jumped into this. I didn't have a network. I didn't even know where to start or begin. Like I said, luckily it's kind of cool to be on the south side of Chicago because there are resources for people who are interested, who are starting from zero. But then healthcare in general is exceptionally more difficult. I look at 2 things in specifics. Number one is I look at, the challenge in terms of regulations, data security, making sure all your I's are dotted and your T's are crossed before you're jumping into the space. And then B, I look at the opportunities and resources for founders of colors. And sometimes the numbers speak for themselves. The numbers that I always look at are, I haven't seen the number, but I've heard it a million times before. Something like 1% of venture dollars go to Black founders, and I think another 1 or 2% go to Latino founders. I was looking at the Y Combinator numbers, which, if you're not familiar, Y Combinator is an elite accelerator program, and I think that this year, this quarter, 4% of founders were Black. Last time, 2% of founders were Black. So I don't see a lot of resources, and for me personally, if I had known that starting, I might have reconsidered. I've been really fortunate, really blessed to meet some great people and to have, I guess, either I'm, maybe a little bit crazy because I keep going even when sometimes it looked really, really dark. But also I had, really good people around me to keep me going. And just so we are venture backed, so we're lucky in that regard, but it's definitely hard. And then in the industry as well, for instance, like right now, we're closing a deal with a Fortune 10 company pretty soon here. And in some of the expectations in healthcare are really, just not normal. They expect you to do pilots for free. Imagine $1 billion company saying, hey, we want a discount, or we want you to do this for free. Like, that doesn't sound normal. And in most industries that would never fly, but in healthcare, there are exceptions to almost all the rules. So you're just kind of playing founder, but on either hard or very hard mode in some instances.
Yeah. Yeah, definitely, right. The disparities are real. And so one of the statistics I gave is around, between Black and Latinos, we make up 1/3 of the population, but yet receive less than 3%, is 2.7% of venture capital. And so, but there are pluses, right? And so, you said there are limited resources, but can you talk, both of you share, what are some of the resources that you have been able to take advantage of, whether it be an incubator, tapping into some mentors? If you're open, you don't necessarily have to give the dollar amount. Have you been able to raise capital? Can you talk a little bit about that experience?
I can start with that one. Yeah, so I think there's specific programs, firms that have started with a mission to help Black and Latino founders, and yeah, we've been fortunate to be able to partner with some of them. Just to give some names. Long Jump is one early stage VC here in Chicago that focus not underrepresented ideas. That's how they call it. Visible Hands is another of the early stage VCs we work with. They are focused on their mission is they are not super focused in healthcare, but they look to invest in diverse founders as well. And then there's the programs with Google, the Google for Startups Latino Founders Fund, the Google for Startups Black Founders Fund. We did a program with them, and that was super helpful. So yeah, on one end, it's really tough to be out there racing, but it's good that all of these like specific programs exist, and at least we've been able to take advantage of some of them.
Gotcha. James, how about you?
Yeah, in terms of fundraising and resources, I think to date our company's raised $1.6 million, and we're just opening up another round right now. That's been hard fought to get. Actually, some of our investors who are really close to the company, they've doubled down and tripled down. So, it's nice to see that, but it's still, like I said, tough. Fundraising is just very difficult in general right now. And if you go look at the numbers, you can kind of see that the story's pretty clear, and especially around healthcare. In terms of resources, I think another thing that I learned was, like location in terms of where you decide to be a founder. Being in San Francisco, where something like 70 or 80% of all VC dollars are deployed, is definitely like a very, I think that's like maybe a smart move if you're concerned about resources. But in terms of being a diverse founder, being Black, Latino, or other, Chicago is actually a great place to be for that, because there's lots of founders that look like you and lots of resources. Again, the South Side has the Polsky Center at the University of Chicago. There's Matter and 1871, which is really diverse in general and open to founders of all color. Personally, we did Techstars and the SoftBank Accelerator. And also just in general for my own mental health, anytime I had an opportunity to be in a group where there were other diverse founders, I always signed up, because the potential scenarios and realities that you have versus some of your counterparts might be completely different, right? They might be doing that they might be doing a startup for sport where you invest in your whole life in your 401k in this company, and this is going to be your retirement. So you better make it worth it, right? So it's just different, and just having people who might understand that is helpful. Like another thing, like I used to read early on was when an investor would say, hey, why don't you this isn't ready, why don't you go to your friends and family and ask them for money? And you're like, ask what do you mean? People do that? You can go to your friends and family and get $25,000 and $50,000 checks. That's not necessarily a normal reality to people, at least in my circle. So those was one of those tough realities that I had to learn. But again, being amongst other diverse founders and the networks is, I've always found a lot of solitude there.
Yeah, I think community is strong, right? And so one, it's a sense of understanding, empathy for each other, the struggle you're going through, but at the same time, you can piggyback and learn from one another. So community is definitely going to be strong from a knowledge space and from a mental health being of being able to relate. With that, we talked a little bit about some of the pitfalls or some of the disparities when it comes to raising funds are hard. This day and age when diversity, equity, inclusion has almost become a bad word, or just, we're in a different state where it's been politicized. Have you seen any trends, when we think around impacting diverse founders of more recent? Have you noticed any trends or anything lately? James, we'll go back with you and then we'll go to Luis.
Yeah, I mean, I'm just looking at the data, and I do look at the data. There's an article, I'm trying to remember, maybe if I can remember, I'll reference it later on, but it just kind of talked about how like venture dollars to diverse founders has basically plummeted in like the last 24 months or 2 years, when there was a time where getting venture funding was, I would say easy in quotation marks, but I think one of the first groups that got hit once the venture dollars started slowing and the VCs got more conservatives were diverse founders from what I've read. And I think those are credible sources. I'll try to reference it later on, but I think that's again, something that's more important than ever before right now is like just getting traction, like real traction, which is also can be very difficult in terms of healthcare. Most companies, you can go and set up a company in a month or two, you have a full product deployment. For our product, it took us 2 years to get it from first line of code to a customer in hand because of all the HIPAA workflow, et cetera, building from scratch. So just things to consider there.
Yeah, I think definitely, if you look at the numbers, it's the situation is messed up for sure, and it's been in 2021 kind of like there was progress being made, but now once the VC dollars are now like everything got harder. Like Black and Latino founders have been raising less. I think all of those are facts in terms of the conversation and how it's evolving and DEI and like the issues in universities and everything that definitely can impact. It's like another voice and yeah, I think the underlying thing and that like the we have to believe that investing in Latino and Black founders, diverse founders is going to bring better returns, and in many cases I think in healthcare, we many times are building for problems that we experience ourselves, or we know communities that experience these problems, and who's better to build for a solution for those problems that people that experience them know, and people that know the community, and so in many times I do feel that there is that founder market fit as well, and the perfect founders to solve some types of problems, and that many times it's folks that look like us and folks that come from diverse backgrounds.
Yeah, well, thanks for that. I mean, right, there are disparities there. There are definitely some barriers that are there, but at the same time, two of you are both, examples of perseverance as well as success. James, you mentioned raising over 1.6 million. I want to pivot a little bit, right? So we're coming up a little bit closer to time. We have about 4 questions. I definitely want to ask you guys 2 more questions, and then we'll go to our audience. We have like 4 questions waiting, but if you don't mind, maybe 2 more questions that I thought about before. But if we think about being encouraging, and for those people that might be on the line that are either aspirational or they're in the struggle just like you, maybe if either of you can share, something specific success story that or achievement that you're particularly proud of. Give us the flip side of it, right? It's hard to raise capital. It's hard sometimes being a founder, but what are some of the joys? What are the things that you have been proud of? Luis, I'll start with you, and then we'll come over to James.
Yeah, being able to get traction and getting users, and we're at a point where we do around 1,500 sessions a month, and have active users and folks that are enjoying using our services. So yeah, a lot of people, a lot of them are first time being able to afford and having mental health services of some sort or an alternative. So they like they're seeing firsthand like just the benefits of working on their mental health, and in a preventive way as well, like trying to find ways to improve and your life and your mental health. So yeah, just our testimonials from our users, and especially the ones that are first time users. That's some of the things that are very, very rewarding, and you don't have that in many other careers out there.
Yeah, nice. Congratulations. 1,500. I know it's going to keep growing, but 1,500 a month, 1,500 users a month is great. So thanks for sharing that. James, how about you?
Yeah, I think it's something about literally building something from scratch that's just really special. Like, how difficult it is, how there's no roadmap for it, how you have to figure it out by yourself, and you have to use every skill that you've ever learned in your life. And then with like these hands, you're like, with these hands, I had to build this from the ground up. Like it's actually on the computer, but you guys know what I mean. But yeah, in terms of scripted, I think that when a lot of people say the world is turning to digital, we disagree. We say healthcare is local. And the most accessible and prevalent healthcare professional in most communities is the local pharmacist. And the fact is that we are enabling patients to get care for things that they sometimes have to go to the ER for unnecessarily. It's just because there's no other better options. They run out of an asthma medication or an EpiPen. They've had, they don't know if they have COVID, strep, or flu. And to be able to take that patient and say, hey, go to your pharmacist instead. And that pharmacy, who has been getting screwed over by pharmacy benefit managers for the past 2 or 3 decades, who's getting low margins, we're now bringing net new revenue to them, and it's reestablishing their relationships with their patients. So it's kind of one of these scenarios where everybody wins. The healthcare system actually works better when when the solution that our team built is being utilized. It's always more affordable, more accessible, and a net new visit that wouldn't have happened otherwise without our company. So we love knowing that, and it makes us feel really good about what we're building.
Well, both of you providing services, right, that just are showing true benefit and access that otherwise might not have received. So thank you both for that. Right, James, you talked about with your own hands, you built this, right? And so some of it is really, blood, sweat, and tears early on. It oftentimes you don't see the money or the return, but if you have people that are here in the audience that are thinking about it, that are, again, have an idea that they're working in a job and they're like, I could do this better, or there's something that's missing, from your experience, just can what would you offer to an aspiring entrepreneur that either has an idea or is kind of stuck in the rut? What words of wisdom, or just share, some of your experience to someone who's thinking about it, or like I said, in the struggle, just like you, who hasn't raised that 1.6 million yet, but just share some insights for us.
Yeah, it's I want to be brutally honest here, but also, I want to be honest from both angles. There's like the good and the bad, and probably mostly on both extremes. But the good is that you get to go out and change the world to how you think it should be, right? And there's just something really special about that. But it's not going to come. The bad news is it's not going to come easy. In my opinion, I think that this will be the hardest, most difficult journey that any person could ever go on. And you have to really consider that, because it's a lot harder than you could ever imagine. When you have, $200 in your company account and your employees are wondering why their check, or when, if their check's going to come in, has the investor gotten back to you? That's scary, right? Like that's really, really scary. So, those are the kinds of decisions, on top of executing with clients who don't really, they don't, before they're your customer, they don't care about you. They don't know you. They don't owe you anything. So you literally have to build this all from the ground up. You have to figure out every single angle. Myself, I'm a pharmacist. I was not a business person. I had to learn, all these metrics and how to talk with investors, and how to do sales and marketing, and payroll. It's all these things that you have to do. So I would say make sure you think about it long and hard. You know, it could definitely affect your life, but for the positive too. You know, it's just going to be a journey. You know, and everybody's journey is different, but it will be a journey. It's gonna, you know, you're gonna see your family less, your friends a little bit less. But that's the good thing, because you know, if you make it out on top, then hopefully it's all worth it. So it's just one that, you know, think about, consider, talk to some smart people that you trust, talk to some founders, ask them questions. But it's definitely a life-changing experience.
I don't know if that was necessarily encouraging, but no, it was good. It was great insight. I mean, the one thing is that, right, you've got to have fortitude.
Honest.
Right, honest, right? You've got to have fortitude. You know, the one thing that you shared a little earlier was that you've seen people that were founders before that are now founders again, right? And so it is a lifestyle change, because it seems like once people make that step over, then oftentimes they don't go back, right? If they have to reinvent themselves within another company, within their company, and just kind of stick it out, it does seem like once you make that leap, you kind of made that leap, right? Is that fair? You've seen that, or?
Yeah, you do. And you get skills that, you know, again, they just change your life forever in a good way.
Yeah. Luis, how about you? Any insights you'd like to share from your experience, or just, you know, some skill sets you've developed, some thick skin? I'm sure you've heard no more times than you ever thought you would. Share some positives for us.
Of course. Yeah, so I think some good advice that I got at the very beginning was to basically just start and start maybe only by getting feedback, understanding the problem that, you know, your target user or client is having, interview them. It doesn't have to be perfect at the beginning, and especially I would recommend at least having something tangible, like hopefully paying users before trying to get in VC investment, because you know, like I can put together a PowerPoint deck, and this is something that I did myself, but eventually, you know, like and I actually found that I don't have the technical background, so I'm more of a business person, but I found a lot of tools that I could put together and actually build the MVP myself, build the first website, and kind of like have something functioning. So when I was able to start my conversations with investors, we had paying users, and started while still at my old job as well. So I you know, and over the weekends I'd be like really excited about this idea, and just putting the MVP together, and eventually I was able, and it doesn't have to be perfect. We didn't have the team at first. It's been like super hard. Like everything is hard, like the sales, raising money, having people join your team, especially at the very beginning. Everything is super hard, but I think to start, you don't have to have everything, and you don't have to wait to have everything be perfect. But just I think if you can, you know, get going, it's going to eventually, it will work out.
Yeah, I don't want to take anything away from what you guys have offered. One of the things, if I've talked to different startups, one of the things that I try to suggest, though, you've got to tap into your networks, right? You can't do it alone, or try not to do it alone. Tap into your networks. I oftentimes also suggest, I'm just a proponent of focus groups, trying to bring in subject matter experts, trying to bring in other people just to kind of give you some feedback, some evaluation on what you're trying. You know, oftentimes, again, startups are being founded by people with an idea or a passion for their own lived experience. But when we think about it, this is a business as well, right? It's not just on the base and on the feeling and the emotion. It is, how do we create a business around solving for a problem? And so I think focus groups are key getting in perspective outside of your own helps early on. If you, instead of going down the road too far and then trying to bring in perspective. And so with that, I want to thank you guys again. We have a couple questions. We will wrap up with some commentary as well. But there's a question earlier on by Guy. I'll take this in order. Guy asked this question a while ago. So thank you, Guy. I hope that you're still on. And he asked, he said, with a focus on digital innovation, how do we ensure that those don't have access to high-speed internet don't get left behind? How do we combine digital and brick and mortar? Either of you want to tap into that? I can add some perspective after.
Sure. We create scripted so that people have access to care in person. No, I think something that is very concerning to me, is how some folks are, thinking that digital solutions will cover all the gaps. It's just not true. It's very concerning when a patient with a mental disorder that needs a long-acting injectable antipsychotic for their, bipolarism or whatever, has to drive 2 or 3 hours to a doctor's office because there's none in their community. Digital health does not cover that. That's one of those things where pharmacists are stepping in, using scripted and doing that. But I think that, whoever made that point, I think I'm trying to fight the good fight with you and remind people that healthcare, at the end of the day, it's still local. I think another interesting thing is I was looking at some data points recently, and I was looking at the rise in urgent care, and urgent cares have grown something like 1,000% in the last 10 to 12 years. Just really, really, because they're providing a care gap, for people who don't necessarily need to go to the ER, but can't get into a physician. So they're utilizing urgent care. And I don't know if anyone's talking about that as much, but again, kind of showing that demand for the brick and mortar and those patients with minor ailments. So, but yeah, I definitely agree with the point that the person who asked the question made.
Yeah. Well, Guy, I hope that answered your question. You can do a follow-up. But with the interest in time, we have a little less than 10 minutes. We have 3 other questions. And so this question actually probably would be toward you as well, James. This is from the Queen. With recent AWS acquisitions, does that mean the role of the pharmacist has less value?
Was it AWS?
Yeah, I think it's Amazon Work Solutions. Is it not, or AWS?
Yeah, I'm hoping so, but I'm not sure. Can you read the question one more time just to make sure I understand it?
Sure. With recent AWS acquisitions, does that mean the role of pharmacist has less value?
Oh, no, I think what we're seeing is that states are actually expanding the regulatory role and allowances of pharmacists, and pharmacists are betting big on clinical services. So we see pharmacists stepping away from counting pills. We see states enabling pharmacy technicians to start helping out the pharmacists, take blood pressure, give vaccines, and even dispense medications by themselves, so pharmacists can spend more time doing gap closure. So we see a lot of that happening right now. And again, that's kind of the mission of scripted. A little bit biased, but we do see it happening in full droves, and people, pharmacy leaders actually making investments in that space to offer more care coordination.
Thanks. We have like 3 more questions. I know we're going to try to wrap this up before the end. With this can go to either of you. If you were to start a business as a consultant in the healthcare industry, what would you say what would you guys say would be a good growth opportunity? As you guys think about that, I'm often think about it should be something you're passionate around, something you have knowledge and interest in first and foremost. I definitely think there's some spaces, there's an opportunity within behavioral health, senior care. You think about data analytics. I don't know, Luis, James, what are your thoughts on, what would be some great or good growth opportunities within consulting for healthcare? Health equity is still going to be important. Quality. I think it all depends also what your specialty is, or what your knowledge base is. What would you say, Luis?
I think with all what's happening in AI, I think some of the super interesting use cases and some of the places where folks that know a lot about AI, like NVIDIA and similar, and are thinking about how to fit AI into healthcare. And given all of the yeah, like how disjointed the data is, and just seemed, I think there's a big opportunity to leverage some of what is happening in AI in healthcare. It's obviously gonna require a lot of doing it in the it has to many times happen within the incumbents, but you're mentioning like consulting, so like coming in as an expert and finding solutions for some of these big healthcare companies with AI, I think could be a good opportunity.
James, if you can add some context, we're gonna have one or two more quick questions, but do you have any comment?
Yeah.
On that one?
Just be very helpful. Do your first, if I were you, I would do my first couple services for free, just to kind of, build that rapport with folks and go through the entire cycle of sales, understanding the customer and then delivering a good solution. So the next time they'll want to pay you and they'll recommend you to your friends, kind of build that word of mouth. Just be very helpful, right? And I think also AI could be competition to that. So you got to be very helpful, in my opinion.
All right, this question probably should speak to both of you and a few others on this call, but it's anonymous, but it says, how did you know when it was time to go full-time on your venture versus continue to spend time kind of as a side hustle? When did you dive completely in, or how did you know?
I can talk about that one, and just to your point before, Philip, I think, like those, like sharing your idea and getting feedback with your friends and everyone is super important. And I wouldn't go about this like, oh, I have this idea, but I'm not sharing it with anyone because I don't want anyone else to steal my idea. It's the definitely getting the feedback from all of your friends, all of your family, and everyone. It's super important before starting. In my opinion, depending on like how long you can have the startup as a side hustle, I think it makes sense, and there's different flexibility in jobs. My specific job as a management consulting before this, I didn't have a lot of flexibility, and it's a very demanding job. So I went into this earlier than I would have liked. And so, I mean, we had like a working MVP, we had a few paying users, and then still it was a little time until we were able to raise our pre-seed round. So yeah, I think there are jobs where it's easier, and even some jobs that kind of are like that folks have side hustles and everything. So I think it depends, but I would try to I would try to maybe like tie it before, like just leave that job right when you are able to raise a pre-seed round or something like that, and which also is going to be difficult to raise a pre-seed round if you haven't left your job. So maybe try to get like a month in between or something like that. But that would be my advice.
James, I see you shaking your head. What's your take?
I agree with Luis, and I think also I was not. I wouldn't recommend doing what I did. I just kind of jumped right in, and I just kind of rolled the dice and saw what happened. But which is part of being a founder. You have to persuade people to give you money to join your team, and they must be crazy too, right? Especially if you're a first-time founder. But that question I think is a really personal question because it's going to depend on your circumstances. I don't think I would have done this if I had a family, if I was married and I didn't discuss this with my partner. You know, there's a lot of factors and considerations, but that's kind of what I was talking about early, just making sure that, you know, before you jump in, you are being thoughtful, because, you know, if you don't have a plan, if you're not prepared, you know, this stuff could really, you know, affect your well-being, financial, health, and otherwise. So, but just think about it, talk to people, like I said, tap into your community and ask them for advice, and other founders as well.
Well, thank you both. You know, we're coming up on 7:30, and we just want to be mindful and respectful of time. I want to thank everyone. I would definitely want to extend my gratitude and thanks to Matter. Again, they are one of the premier healthcare incubators. They're located right here in Chicago at the Merchandise Mart. Olivia and Kay, thank you so much for putting this program together in conjunction with me. I definitely want to thank Tierra and the whole NAHSE. For years we've been calling it NAHSE, but now we're going by the acronym. But NAHSE Chicago, as well as a national organization, you guys are the premier association for African American healthcare leaders. NALHE, National Association of Latino Healthcare Executives. You are a growing group of people. I'm actually wearing my ACHE pin of American College of Healthcare Executives, just because NALHE and NAHSE were already represented. But these are associations. If you're not involved, please get involved. There's tremendous community networking. Want to thank our speakers, Gyasi Chisley, my brother from another. Thank you for sharing your insights and knowledge around just the landscape of healthcare. And to our panelists, James and Luis, brothers, thank you so much. We're going to do something again. I appreciate, you know, the hard work, sacrifice you guys are doing. You're starting to see payoff. James raising 1.6, that should be commended. It is something special. Luis, to have over 1,500 users a month, congratulations. The service that you're providing for the Latino community is to be noted. So thank you, everyone. Hope you guys have enjoyed this discussion, and hopefully there's an opportunity to connect to some other tape. Good night.